Okay, let's take a look at the structures that are listed after cervical nerve roots. So the first structure is the brachial plexus, and as I described in the previous video, a plexus is a blending of nerve or neural fibers from different cord levels. And since this plexus or blending of fibers is the brachial plexus, that means that these neural fibers are going to be responsible for carrying neural signals to and from structures in the brachial region of the body or the arm region. So here we see the brachial plexus, it's highlighted. These would be the cervical nerve roots, C5, C6, C7, C8, and T1. And these cord levels, the fibers from these cord levels you can see are going to kind of blend together so that the terminal branches of this brachial plexus, for example, the median nerve or the ulnar nerve or the radial nerve or the musculocutaneous nerve or the axillary nerve, these terminal nerves are going to have fibers in them, neural fibers that come from different spinal cord levels. So here we see that highlighted. If I remove the highlight, here we see the brachial plexus. The next structure to identify is the musculocutaneous nerve. So here we see the musculocutaneous nerve. The musculocutaneous nerve is a superior branch off of the brachial plexus, and if we look at the brachial plexus closely enough, we can see that in this region, in the axillary region, there is an M that forms. So the letter M going up, coming down, coming back up, and then going down here. So this M that forms, this part of the M right here is going to be our musculocutaneous nerve. So the musculocutaneous nerve is going to be innervating biceps brachii muscle, for example. I'll remove the highlight on that and then add it again so you can see musculocutaneous. The next nerve to identify is the median nerve. So again, if we identify that M here, the median nerve is going to be the nerve right in the middle. So this is going to be median nerve right here. So let's go ahead and bring up that median nerve. So there it is. There's the median nerve. The ulnar nerve, so if we look at our M again, so we had this is one part of the letter M, this would be the middle part, and then this would be the kind of most medial part of the letter M. This branch right here is going to be the ulnar nerve, and we can see that there. So it's musculocutaneous, most lateral, the median nerve is right in the middle, and then the ulnar nerve is the most medial. These nerves, the musculocutaneous is going to largely stay in the upper arm. The median nerve and the ulnar nerve are going to travel through the upper arm, through the forearm, and down toward the hand. The axillary nerve, so I'm going to highlight the axillary nerve. So the axillary nerve, to see this we have to remove some of the brachial plexus because it is a very kind of dorsal nerve coming off of the dorsal part of the brachial plexus, and we see that here kind of traveling into the axillary region, so that would be our axillary nerve. The radial nerve is the next nerve to identify. So here we see the radial nerve, and again the radial nerve looks to be in a similar position as the median nerve, but it's going to be kind of more posterior. So here we see the median nerve, and sitting behind it would be our radial nerve. So we move that, and we see the radial nerve is more posterior. The suprascapular nerve, so the suprascapular nerve, supra is a prefix that means above, scapular. This nerve off of the brachial plexus is going to be going over the scapula. So let's go ahead and take a look at the suprascapular nerve. So we see it comes off the brachial plexus more proximal, so kind of closer to where the roots are. We see it kind of jump off of the top part of the brachial plexus and go over. This is the scapula here. go over the spine of the scapula.